Good evening. Today I am Dr. Aseshananda Dutta. Today our discussion and topic of discussion is understanding hypertension. So, what is regarding high blood pressure? Hypertension means high blood pressure, and today we discuss what is high blood pressure and how to prevent it. Generally, everyone would like to have a healthy or normal blood pressure, but what exactly does it mean? Basically, each time when the heart beats, it pumps blood into the blood vessels. This creates pressure against the walls of the blood vessels, and this is in turn called blood pressure. Normally, in healthy persons, it rises and falls throughout the day, but when blood pressure remains high for a longer period of time and left untreated, it can lead to serious health hazards. In general, persistent increase in blood pressure higher than normal level is known as hypertension. High blood pressure usually develops over time. It can happen because of unhealthy lifestyle, for example, not having enough regular physical activity, obesity, smoking, high alcohol consumption, stress, etc. There are other risk factors also that can increase the risk of developing hypertension, such as age. As people get older, the arteries get stiffened up and narrowed as excess of fat builds up. Family history of high blood pressure: one or more close family members with hypertension increases person's risk of developing hypertension. Excess salt intake is also an important known factor. Not eating enough foods with potassium can increase blood pressure and risk of stroke and chronic kidney disease. Eating processed and fatty food increases the fats throughout the body and make the heart work harder to push blood through the body, hence causing blood pressure to rise. On the other hand, lack of physical activity is also linked to obesity and further leading to high blood pressure. Another one is stress. Reacting to stress in unhealthy ways or not managing stress properly can increase one's blood pressure. Now moving on, hypertension does not have any obvious signs and symptoms. That is why it's often called silent killer. But it puts people at risk of several diseases from cardiovascular to kidney failure, stroke and even eye damage and blindness. Hence, early and accurate diagnosis, early and accurate diagnosis is very important in management of hypertension. Measuring the blood pressure is the only way and the easiest way to know whether person is having high BP or not. Generally, when symptoms do occur, they include morning headaches or tiredness, vision problem, blood buzzing in ears, fatigue, nausea, vomiting, etc. If person is experiencing more of these symptoms, then one should get their blood pressure checked. Fortunately, high blood pressure can be easily diagnosed by instrument. It's called sphygmomanometer. It is recorded in two numbers. One is systolic and one is diastolic. A healthy or normal blood pressure should be lower than 120 or by 80 millimeter, or it can also read can be read as 120 over 80 millimeter mercury. Here, the upper number indicates systolic blood pressure, which means pressure in the blood vessels when the heart contracts, whereas the lower number indicates diastolic blood pressure, means the pressure in the blood vessels when the heart beats rests between beats. If blood pressure level is or more than 140 by 90 millimeter mercury, then the person is by definition having hypertension. If the person have BP levels higher than these, then he or she might be at risk of developing some serious heart diseases. This risk of developing heart diseases can be prevented or reduced by taking steps towards a healthier lifestyle, such as regular exercise, healthy diet, quit smoking and reducing alcohol intake, regular blood pressure monitoring, stress management, adherence to medicine. If blood pressure is successfully controlled with such lifestyle medication and modifications, then it might avoid, delay, or reduce the need of medication also. So let's take a look at these strategies one by one. First of all, regular exercise or physical activity. Exercise can be a drug-free approach to lowering the blood pressure. Regular physical activity makes person's heart stronger. If one have a strong and healthy heart, it can pump more blood with less effort. So if heart has to work less to pump, the force on the blood vessel will decrease and lowers the blood pressure. In other case, as we all are aware that age and weight gain are two major risk factors for high BP. So if the blood pressure is at a desirable level, that is less than 120 or by 80 millimeter, then exercise can prevent it from rising with your age as well. Regular exercise also helps to maintain a healthy weight, which in my opinion is an important way to control blood pressure. One should aim at least 30-minute aerobic activities most of the days of the week. High BP can be reduced by doing regular structured exercises such as brisk walking, jogging or swimming, etc. Number 2 point is healthy diet. Diet also plays an important role in controlling BP. A diet with high intake of vegetables, fruits and whole grains is recommended for hypertensive patients. For lowering blood pressure or preventing hypertension through dietary intervention, one can adopt a dietary pattern such as DASH diet or Mediterranean diet, eating less saturated fat and total fat, getting plenty of potassium, limiting the amount of sodium in the diet, and limiting alcohol consumption. DASH, now the term DASH stands for Dietary Approach to Stop Hypertension Diet. Eating a DASH diet that is rich in whole grains, fruits, vegetables, low-fat dairy products and skimps on saturated fat and cholesterol can lower one's blood pressure by up to 11 millimeter if having high blood pressure. Now, reduce sodium in your diet. Even a small reduction in sodium in diet can improve the heart health and reduce BP by about 5 to 6 millimeter. If you have a high BP, to decrease potassium in your sodium in your diet, you can consider tips like read food labels if possible, choose low sodium alternatives of the foods and beverages you normally buy. Eat fewer processed food, only a small amount of sodium occurs naturally in the foods. Most sodium is added during processing, so you can eat natural products. Don't add salt in your during meal. Just one level teaspoonful of salt has 2300 milligrams of sodium. So avoid adding salt to food. Use herbs or spices to add flavor to your food. Third and most important point is quit smoking. Stopping smoking helps your BP return to normal. Quitting smoking can effectively reduce your risk of heart disease and improve overall health. Regular blood pressure monitoring. Some of the hypertensive patients check their blood pressure by visiting doctors only. But it is not always possible for patients to visit doctors and check up their BP. Hence, most often I advise patients to self-monitoring their BP at their home. Self-monitoring helps person to measure BP at different times throughout the day and over a longer period of time. It also assists doctor to get a more complete picture of person's blood pressure reading at different times. Further helps us in better prediction of cardiovascular morbidity and mortality rather than a single routine BP measurement at our clinic. Stress management is learning how to relax and manage stress can improve emotional and physical health, lowers high BP. Stress management techniques include exercising, listening to music, focusing on something calm or peaceful and meditating. And finally, it is very most important is adherence to medicine. A medicine to lower blood pressure can be recommended by doctor. If your blood pressure is consistently high, usually at or above 140/90, adherence to medicine is very important as it controls your blood pressure regularly. So don't miss your blood pressure medicines at any day, at any moment, and stick to the regime which is prescribed by your doctors. And at last, I would like to suggest that there is nothing more precious than having a fit and healthy life. So adapting healthy lifestyle can help us to enjoy long and healthy life also. High blood pressure can be prevented as well as controlled in many ways. Keeping blood pressure in normal range is very important in preventing cardiovascular and cerebrovascular complications. It is very much possible to maintain a normal blood pressure level with regular monitoring, preventive measure, and with regular medications. Thank you all for the patience hearing.